Most people think of Alzheimer's disease as being a condition in older people, and age is definitely the major factor for developing Alzheimer's disease. But we've long known that there's a subset of people with Alzheimer's disease who develop it before age 65. But about 3 decades ago here in Los Angeles, we saw a patient who was in her late 30s who had signs and symptoms consistent with Alzheimer's disease. And over the next several years, we saw several other individuals with signs and symptoms of Alzheimer's disease who were in their 40s. And when we talked to colleagues in the Los Angeles area at other hospitals and facilities, they had occasionally seen somebody similar who was presenting with memory problems and inability to do regular function, who was in their early 40s. And we came together to realize that many of these individuals shared a common ancestry in Mexico from the state of Jalisco. And then a research effort was brought together to examine these patients and look for some common abnormality that could be leading to this condition. We always knew that there were some genes associated with Alzheimer's disease, particularly in early onset. There are 3 identified genes with early onset Alzheimer's disease, and these individuals were found to have a mutation of one of the known genes, presenilin 1 or PS1, that causes early onset Alzheimer's disease. There are other groups of families, like in Colombia and some other areas of the world, that also share mutations of one or more of these genes. And they are unique mutations, but on the same gene or one of the known genes that can lead to an early onset form of Alzheimer's disease, affecting people in this case in their late 30s and early 40s rather than in their 50s or 60s. And it's a little different and unusual.